This medication is used to help with nasal symptoms such as a runny, itchy, or stuffy nose, sneezing, and post-nasal drip caused by allergies or other conditions. Azelastine belongs to a class of drugs known as antihistamines. It works by blocking certain natural substances called histamines that are responsible for nasal symptoms. It is important to use this medication as directed by your doctor. The usual dose is 1 or 2 sprays in each nostril twice a day. It is best to use this medication at the same times each day. Before starting to use Azelastine Hcl Aerosol, spray with pump, make sure to read the instructions provided by your pharmacist and follow them carefully. If you have any questions, don't hesitate to ask your doctor or pharmacist for clarification. When using the spray pump for the first time or after not using it for 3 days or more, it's important to follow the instructions for test sprays in the air to ensure the pump is working properly. Before using the medication, gently blow your nose. Use it in the nose as directed by your doctor, typically once or twice a day in both nostrils. Avoid spraying it in your eyes or mouth. The dosage will depend on your medical condition, age, and how you respond to treatment. To avoid a bitter taste in your mouth, breathe in gently and do not tilt your head back after using the medication. For the best results, use this medication regularly at the same times each day. Do not increase your dose or use it more often or for longer than prescribed, as it will not improve your condition any faster and could increase the risk of side effects. Keep track of the number of sprays used and discard the pump after reaching the specified number of sprays on the manufacturer's package. Azelastine Hcl Aerosol, spray with pump usually starts to work within 3 hours of use. If you do not see any improvement or if your condition worsens, be sure to inform your doctor. Some possible side effects of using Azelastine Hcl Aerosol, spray with pump include a bitter taste in the mouth, drowsiness, tiredness, nasal discomfort, sneezing fits, cough, nosebleeds, runny nose, dry mouth, headache, or red eyes. If any of these effects last or get worse, it's important to inform your doctor or pharmacist promptly. It's important to note that your doctor has prescribed this medication because they have determined that the benefits to you outweigh the potential risks of side effects. Many people who use this medication do not experience serious side effects. While a very serious allergic reaction to this drug is rare, it's important to seek medical help immediately if you notice any symptoms of a serious allergic reaction, such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing. This is not a complete list of possible side effects, so if you notice any other effects not listed, it's best to contact your doctor or pharmacist. Before using Azelastine Hcl Aerosol, spray with pump, make sure to inform your doctor or pharmacist if you have any allergies or if you have kidney problems. This medication may cause drowsiness, so it's important to avoid alcohol or marijuana while using it. Also, be cautious when driving or using machinery until you know how this medication affects you. If you are planning to have surgery, inform your doctor about all the medications and products you are using. If you are pregnant or breastfeeding, consult with your doctor before using this medication to understand the potential risks and benefits. It's important to be aware of any potential drug interactions before using Azelastine Hcl Aerosol, spray with pump. This medication may interact with other products that cause drowsiness, such as opioid pain or cough relievers, alcohol, marijuana, drugs for sleep or anxiety, muscle relaxants, or other antihistamines. Be sure to inform your doctor or pharmacist of all the products you are using, including prescription/non-prescription drugs and herbal products. It's also a good idea to check the labels on all your medicines to see if they contain ingredients that cause drowsiness, and to ask your pharmacist about using those products safely. Always consult your doctor before starting, stopping, or changing the dosage of any medicines. If someone has taken too much Azelastine Hcl Aerosol, spray with pump and is experiencing severe symptoms like fainting or difficulty breathing, they should call 911 immediately. Otherwise, they should contact a poison control center for assistance. In the U.S., residents can call their local poison control center at 1-800-222-1222, while Canadian residents can call a provincial poison control center. It is important to seek help if there is a concern of overdose. It's important not to share this medication with others. Make sure to consult with your doctor on how to minimize your exposure to substances that can make your allergy symptoms worse, such as pollen, pet dander, dust mites, mold, and smoke. If you forget to use a dose, just use it as soon as you remember. If it's almost time for your next dose, just skip the missed one. Use the next dose at your regular time. Don't take a double dose to make up for the missed one. Make sure to keep the bottle upright and store it at room temperature, away from light and moisture. Avoid storing it in the bathroom and always keep it out of reach of children and pets. When you no longer need this medication or it has expired, make sure to properly dispose of it. You can consult your pharmacist or local waste disposal company for guidance on how to do this. It's important to be mindful of how you store and dispose of your medication to ensure its effectiveness and to protect the safety of those around you. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.